Chest X-ray interpretation. The ABCDE approach can be used to interpret chest X-ray, airway, trachea, carina, bronchi, and hilar structures, breathing, lungs and pleura, cardiac, heart size and borders, diaphragm, including assessment of costophrenic angles. Everything else, mediastinal contours, bones, soft tissues, tubes, valves, pacemakers, and review areas. Airway trachea. The trachea should be midline. Inspect the trachea for evidence of deviation. Pushing of the trachea, large pleural effusion or tension pneumothorax, pulling of the trachea, consolidation with associated lobar collapse. Pushing of the trachea in tension pneumothorax, pushing of the trachea in pleural effusion, pulling of the trachea in atelectasis, carina, and bronchi. The carina is the point or level at which the trachea divides into the right and left main bronchi. The tip of the ET tube should be 4 centimeters above the carina so that both lungs are properly oxygenated. Hilar structures. The hilar consist of the main pulmonary vasculature and the major bronchi. Hilar enlargement can be caused by sarcoidosis or due to underlying malignancy. Breathing. Inspect the lungs for abnormalities. Inspect the lung zones, ensuring that lung markings are present throughout. Increased airspace shadowing in a given area of a lung field may indicate pathology, for example, consolidation/malignant lesion. The complete absence of lung markings should raise suspicion of a pneumothorax. Inspect the pleura for abnormalities. Cardiac. The heart should occupy no more than 50% of the thoracic width. Inspect the borders of the heart, which should be well defined in healthy individuals. Reduced definition of the heart border may be due to consolidation. Diaphragm. The right hemodiaphragm is higher than the left. If free gas is present under the diaphragm, it is pneumoperitoneum. The costophrenic angles should be clearly visible. Loss of this acute angle can indicate the presence of fluid or consolidation in the area, lung hyperinflation. Everything else. Aortic knuckle. Reduced definition of the aortic knuckle contours can occur in the context of an aneurysm. Aortopulmonary window. The aortopulmonary window is a space located between the arch of the aorta and the pulmonary arteries. This space can be lost as a result of mediastinal lymphadenopathy, for example, malignancy. Bones inspect the visible skeletal structures looking for abnormalities, for example, fractures, lytic lesions. Tubes, valves, and pacemakers. Nasogastric tube placement, various tubes and cables will be visible as radio-opaque lines. Artificial heart valves typically appear as ring-shaped structures. Pacemakers typically appear as a radio-opaque disc or oval in the infraclavicular region. Thank you. For more nursing-related videos, please subscribe, like, and press bell icon.